And we've got Lisa Miller with us. Now, you've been on Congleton Radio a few times, haven't you, Lisa, talking about various subjects?
Like friend of the stars now, aren't I?
Oh, you are. You're a star on here now. You'll be having your own show next. But it's a serious matter. Well, it was a serious matter before what you were talking about, but it's a serious matter now because you're coming on to talk about what's happening in the nursing industry.
Yes. So as you know, today, 15th of December, we started with the nurses strikes across England. I've been a registered nurse now for about 16 years, and I've worked in various settings, but predominantly in intensive care for the majority of my career. I've witnessed the deterioration. It's the only way I can describe it. So that's why I wanted to come on and have a chat about why we should be supporting the nurses strike. This is actually the first strike in 106 years of the history of the RCN. Just a bit of background here, that the reasons why the RCN have taken it up, because normally the RCN have had a ban on picket lines and strikes, but the reasons that they have is that 1 in 8 nurses now are using food banks. Some trusts across England have had to set up their own food banks to help them. 1 in 3 are struggling with the energy price hikes, and real terms pay is down £5,000 per person since 2010. So I just wanted to come on and give a bit of support and a bit of background as to why nurses are out there today on the picket lines, and I don't want the public thinking ill of them, because not all trusts have met the threshold to strike. So there's many, many areas across the country that are not involved in strike action. And there's also, with me working in intensive care and A&E, I know as well, and theatres are all exempt from strike. So I don't want people thinking it's all across the whole hospital where we're shutting down. It's only certain departments that are striking in representation for all nursing staff. Unfortunately, we're in very sorrowful and unprecedented times. And I don't want some of the mainstream media, unfortunately, I don't want people to listen to what they're thinking, that we're subscribing into a race to the bottom sort of mentality, that we are really fundamentally striking because the situations that we find ourselves in the workplace are hindering our abilities to give the proper care that everybody deserves. It's less about money and more about the continuation and sustainability of the profession and essentially patient safety. Excuse me.
We're really having a winter of discontent, aren't we?
Massively. We massively are.
You've got the Royal Mail strikes, train strikes.
Yeah.
Nurses.
We certainly have. There's a massive discontent, and we just don't see an end to it at the moment, unfortunately. The theory that you pay less and then get more isn't working within the hospital. The propaganda that the NHS is failing and needs to be privatised also is also ludicrous. It doesn't mean that there's been any more staff within the hospitals, full stop. I'm so sorry. Oh my goodness.
Well, I mean, obviously, you've had a stressful day at work because you've not been striking, have you?
No, I haven't. I'm not. As you can tell, I'm not very well at the moment, so excuse me. There are about 27,000 nurses left on the NMC register in 2022. Unfortunately, there's 47,000 unfilled nursing posts in the NHS alone, which is unreal. I've never known that in my entire career. And this increased by 10,000 in less than 12 months. This is a mass exodus of nurses going into different professions since the pandemic.
I mean, if you think back not long ago, people were on the doorsteps during the pandemic and they were clapping nurses.
That's right.
It's soon forgotten.
It has, unfortunately. Although I'm not sure if we've been completely forgotten. I just feel that our government has possibly forgotten us in all of this. Nurses have cited workplace culture and pressures as the reasons for leaving. And these vital staff members are simply not being replaced. These nurses have endured years of real-time pay cuts whilst trying to negotiate cost of living, additional expenses to be registered, union fees, maintaining CPD hours, paying for parking at work, additional payments for childcare to cover irregularities in shift work, and then the pandemic where some of us have actually died themselves and some of us have become permanently disabled and many of us have developed mental health problems since the pandemic as well. So it really has been unreal, the pressures that nursing staff have been under.
You think this problem's coming from the top? Do you think it's coming from the government, how the country's run?
Oh, I think it's after 12 years, things are just not improving. If anything, we're really taking a step back in standard of living. Society's struggling on all levels, not just the nurses. I feel for everybody who's really struggling with energy crisis, the cost of living, food bills. It's across all walks of society. Nurses are not alone, but it's time for us to take a stand more than anything because, like I say, it's more about patient safety than the money side of things. Nurses are not greedy people. It's all about making sure that our patients are looked after and looked after in a manner where you would expect them to be cared for and holistic care is all attended to, not coming in to your job and for your face and you're that overwhelmed that you do not know where to start and you know that you'll end your shift feeling awful because you're leaving people in a state that you would not feel fit for your own family. So this is why there's people out there striking now, because they can't carry on with these staffing constraints that we're seeing. It's unsafe and it's unfair.
What do you think should be done to stop this crisis?
Well, when they removed the bursary for the nursing degree, it was a disaster. So nobody can come in and train as a nurse now and be realistic. You know, you're working full-time hours as well as doing a uni degree. It's not like you've got time off. You're working full-time in the hospital as well. So how many people can afford to do that, run a family, run a car, and then receive no funding for that? So paying university fees of $9,000 a year, and then you're coming out after 3 years with a huge whopping bill. That was the worst thing really for me, because it made the profession unattractive to even be recruited. So anyone that's retiring is now not getting replaced. That's number one. And then number two is the people who are already working need to have the time to mentor these new staff. When you're running around trying to attend to all patients' cares, there isn't the time to mentor these people properly so that they're learning the job. So they're aware of it. And the dropout rate is phenomenal. So I think the percentage is about 24% of people who sign up at UCAS to do the nursing degree actually finish after the 3 years. So despite them recruiting lots and lots of students, the people who pass through is pretty low.
Yeah, I mean, it's a real problem, but do you think that problem has been made worse with Brexit?
Well, 100%. All my European friends have all pretty much, bar a few, have all gone home, yeah, because it was so difficult for them to come back and forth from Europe. A lot just decided to pack up and just go back because it was too much of a faff in order to keep going, in order to just go home. So yeah, I would definitely say that. There has been a large recruitment drive further afield. But again, it isn't as easy for people to come from further out, say Australia, etc. It isn't as appealing for them because ultimately people like to be not too far away, which Europe isn't, in order to get home.
Yeah.
From my experience of people I've worked with from overseas.
It's almost like a double whammy. It's the people from Europe, they've gone, and the people that would be trained up are just not getting trained up. No,
that's true. And it's just not an appealing situation to come into. People widely know how busy the hospitals are. There's not many that are going to want to take that on.
Have you thought about leaving yourself?
Oh, I did, especially probably say around 2020, 2021. It was a really burning out situation, but then kind of got back into it. I cut my hours for a bit, just went really low part time, and then I've gradually got back up to my usual hours. But now, if anything, the staffing is as bad as during the pandemic, just because of the mass exodus that we've had since it's happened.
Do you think things will improve? Or do you think this is a way of privatising the NHS?
I don't know. I don't know how things are going to pan out. I couldn't possibly guess how it's going to go. It certainly looks that way, doesn't it? But I don't know.
I know some people, they'll turn round and let's say they've got good positions, and they turn around and they say, well, we've got private healthcare. But one of these positions, one of these people in these positions the other day, I noticed they were talking about it, and they were having an operation, and the private healthcare will pay for it. But there was a stipulation where this is what it will be if your private healthcare won't pay.
Yeah.
So it's the devil is in the detail. You might think that you've got private healthcare.
Yeah.
But there's always that little detail where, yes.
The fact is as well, Stuart, is if it's all right going private, I've got nothing against it. If you can afford to go and have an operation privately, that's great. But if you become critically unwell, the first place they take you is straight down to an NHS hospital, because that's where all the expertise are, and that's where the critical care beds are. So it's absolutely fine if you want to go private. But like I say, if you are wanting top-notch care, then you're going to be struggling if you're going to an NHS hospital that's got no staff and it's really, really facing winter pressures. It's going to be extraordinarily busy, and it really is really shocking sometimes.
It's dicing with death, and it's going to affect everybody.
Yeah. You're watching people spinning 20 plates, but they're not spinning 20 plates. They've got lives on to look after. The responsibility is immense. So, it really is something else.
And you're also, you've gone into politics. As you're going for the Green Party, trying to get in, is it Cheshire East and Congleton Town? Yeah, all being well for next year, the May elections, yeah. Are you going for both? I am, yes. Do you think all being well. Do you think you've been inspired by your story with being a nurse? Yes, I would be, yeah. I definitely feel like it's time for change. I feel sometimes you just got to step up to it yourself. So that was probably the thing that kicked me off, thinking, well, if we're sat waiting for everyone else, then why not step up to the plate myself? You're a doer. That's the thing. You've decided if no one else is going, like you say, no one else is going to do it, you'll do it. Yeah, absolutely. Sometimes you just got to step up. I've had a few people say to me, why not? Why not? You go for it. So I thought, well, yeah, indeed, why not? So I went for it. I can only try. Like you say, though, it's quite stunning that the nurses, how many years is it? 160 years that they've never...
106 years they haven't striked.
106 years since they've not had a strike. It shows desperation. Yeah,
it certainly does. Like I say, they're out there representing everybody who are desperate for change. It needs funding. It needs appropriate funding, and we need a proper recruitment drive, and not just throwing out phantom figures in Parliament that are complete untruths. It needs appropriate funding from top to bottom, really, just so people can be safe in their jobs and the patients can be safe in appropriate levels of care.
Look after your NHS and your NHS will look after you.
Absolutely. Thanks, Stuart.
Well, thanks for coming on today, Lisa, and talking to us.
No problem. Thank you so much for having me.